Hello, everyone. I'm Professor Roberts, and today we're going to talk a little bit about drug therapy. This slide goes over your student learning outcomes. You can take a moment to pause this video and review these at your own discretion. So, starting with drug therapy, it is important to have a good base knowledge of pathophysiology. Why is that important? Well, medications increase or decrease natural pathways that we find in the body that already exist. For instance, the respiratory system. A lot of people with pneumonia end up with an alteration in oxygenation. That alteration sometimes can cause certain things like bronchospasms or increased mucus production. And we would use a medication to decrease that mucus production or a medication to alter those bronchospasms. Another example, let's say the digestive system. For instance, a lot of times when people have GERD, a lot of people can relate to GERD as far as like acid reflux. When you have acid reflux, what do you do? Well, you take an antacid. What does an antacid do? It helps alter the amount of stomach acid your stomach is holding, right? Because GERD sometimes can be caused by an increase of stomach acid because of the foods we eat, right? So it is important to understand these pathways and pathophysiology and the natural pathways of the body because it helps you understand what a medication will do to that part of the body. So when we do an overview of drugs and how they affect on systems, again, we already touched on, let's say, the respiratory system and the digestive system. But we start talking about mechanism of action, and you'll hear that a lot when we talk about drugs, right? What is the mechanism of action? It describes how drugs work on a cellular or molecular level. For example, drugs may interact with specific receptors, enzymes, or ion channels to produce their effect. Um, I don't know if you really remember in pathophysiology when they say like certain things have a key, right? If it's like a drug, it'll fit in an enzyme. Enzymes fit kind of like puzzles and keys. So sometimes you can use a drug and it will inhibit an enzyme. Another example is like an ion channel, like salt and potassium. You learned a lot about electrolytes in Nursing 142, um, and how certain medications can help salt move across the ion channel or potassium move across the ion channel, right? We actually have drugs that are potassium based drugs where we will introduce them to the body and help your body increase the amount of potassium you have. Some other medications, such as like insulin, insulin can cause an ion shift with sugar. So that's the mechanism of action of insulin, right? It is to decrease blood glucose levels. A lot of times with ion channels, you'll see that water can follow sugar. So sometimes when you give people insulin too fast, they can have a fluid shift. So these are little ways when we say mechanism of action and how certain drugs work. What is a systemic effect? Systemic effects explain how these actions translate into effects on the entire organ system. For instance, how drugs affects blood pressure or heart rate, right? You'll hear us a lot of times talking about a drug called beta blockers. And I don't want to get too much into it, but beta is in the heart. Beta blockers, that's the name of the medication, it blocks beta in the heart. What can it do? Well, that can decrease your heart rate. And a lot of times when we get into some of these drugs, that's how we know what parameters we're going to monitor. Because if a drug affects your heart rate, then we need to know what that heart rate is before we administer that drug. We briefly touched on the pharmacology textbook in boot camp that we use here in the program. It is Lilly. the pharmacology and the nursing process. And like I said, you'll hear us refer to it as Lilly, the drug textbook. But the one thing I like about Lilly, it shows how drugs are broken down by body system, right? So you'll see like here, part four, it'll show drugs affecting the cardiovascular and renal system. And it'll have a list of those drugs by classification, right? Antihypertensive drugs, anti-anginal drugs, heart failure drugs, um, coagulation modifier drugs, anti-lipidemia drugs. These are all different families and classes, but at the end of the day, they all affect the cardiovascular system. So that's why they're grouped together under that family. I'm sorry, under that classification. And you'll see that a lot. Sometimes it's easier to memorize a drug based off a family or a classification. And we're going to get into that very shortly. So I previously touched on a few cardiovascular drugs. So we break them down by system and then we break them down by classification and families. There are many other cardiovascular drugs. I just picked a few popular ones or ones that you may have seen before. Antihypertensives. A lot of times I like using the name of a medication that will help me remember what it's for. So antihypertensives, I know that if my patient is experiencing hypertension, the best drug to help with that would be an antihypertensive. Same thing with an anticoagulant. If I have a patient who's having problems with clotting or increased, like, let's say, hypercoagulability, like a lot of cancer patients or patients who have just had surgery, post-op patients, sometimes they are at risk for DVTs and PEs, and those are other exemplars we'll go over, but you would like to give that patient an anticoagulant. An antiplatelet, or sometimes we consider those an anti-aggregate. Why do we say aggregate? Because platelets aggregate together. That would be like your aspirin and your clopidogrel. uh, so you know that if you need something that is going to make your platelets not stick together, you need an antiplatelet. And that's why some of these names become important. A statin. Well, you can look at a statin and say, well, what is the statin for? Right? Statins are also known as antilipidemic agents. What is a lipid? A lipid is a fat, like cholesterol. So you'll see that certain families have, certain classifications, they have different names that people know them by, but I always recommend you use the classification that's best for you and also helps you remember what the drug is used for. NCLEX pharmacology classifications, right? And these aren't just for NCLEX, these are drug classifications that you'll see in general. For example, antacid. A lot of you guys probably already know what an antacid is just because heartburn is common, right? We don't really say heartburn, we say GERD. But usually people will go to the store and they'll get a Tums, right? That's an antacid. So they reduce hydrochloric acid located in the stomach. Or we already went over anticoagulants, like an anticonvulsant, right? What does it mean to convulse? It means to have a seizure. So an anti-seizure medication, and that helps with the management of seizures, and sometimes it can even help with the management of certain bipolar disorders. An antihistamine. Oh, what's that antihistamine? Some of you guys take this and you don't even know. Antihistamine can be considered Benadryl, right? Dihydrophenamine. It blocks and releases histamine. Well, what is histamine? Histamine is released by your body, and that's what that allergic pathway is for. So this will block that pathway and help decrease the inflammation in your body, right? That's how Benadryl works. And we already went over antihypertensives, but this is the example we're going to go with, so I'll dive into it a little bit more. Antihypertensives, they decrease your blood pressure. These are different types of antihypertensives here: ACE inhibitors, calcium channel blockers, and beta blockers. Right? So this is how we break it down. We started out breaking it down from a cardiovascular system, right? Antihypertensive is a drug that affects the cardiovascular system. What does it do in the cardiovascular system? What's the mechanism of action? Well, it decreases your blood pressure. All right. Then we break it down to families. So then we take those family names and we have medications that fall under those family names. The best way to get to know these medications is try to find some similarities within the names of the medications, right? So, for instance, ACE inhibitors, lisinopril, enalapril, they all end in pril, right? And if we're lucky, we'll have a lot of medications like that. But sometimes, for instance, calcium channel blockers like nifedipine, verapamil, diltiazem, they all end in different things, but they're all considered to be a calcium channel blocker. Well, how do we remember certain things like this, right? This is when we get a little crafty and we do certain things like mnemonics or anything that you can think of in your mind that will help you remember these medications, right? When I was in nursing school, we always used to use very nice drugs, right? Very verapamil, nice nifedipine, diltiazem drugs. Okay. You have to do what you have to do to help you remember that class of medication. A calcium channel blocker, I can tell you right now, if it blocks calcium in the heart, you do not want to give your patient things that will increase their calcium, such as grapefruit juice. So that would apply to all three of those medications. Beta blockers. Beta blocker, it blocks beta in the heart. Um, these are very common drugs like metoprolol and labetalol, and they all end in LOL. So one way I will remember them is LOL, ha ha ha, beta blockers, right? So there are other medications like this that end in LOL, and then you just start to know, like, okay, all of these fall under the same family name. So I'm not gonna memorize metoprolol. I'm gonna memorize beta blockers, and I know I keep saying memorize, and that's not really the term I like to use, um, because what we try to do with medication is application, right? So how do you apply this to your patient? Well, if it blocks beta, again, I think I said this on a previous slide, then you know it's going to affect the heart rate. So now that you know every beta blocker that you give to a patient from here on out, not only do you need to check your parameters as far as blood pressure, but you also need to check your parameters as far as heart rate. And this is what I mentioned on a previous slide, application versus memorization. All right. You are not going to be able to remember every medication. And that's why we study drug classes and not each individual medication. And we look for commonalities, right? So, um, uh, like the beta blockers, OLOL, or ACE inhibitors with the pril, right? Most steroids end in zone, prednisone, hydrocortisone, virals. Most antiviral medications start with VIR for viral, or diuretics. You'll see they usually end in Zide. These are little ways where we start to group NCLEX pharmacology medication suffixes, or so we can get to know the medication, but we know that this whole class has very similar attributes, very similar parameters, very similar side effects and adverse side effects. So then we go over medication cards. And this is when we get into starting to understand a drug as a classification and as a family, right? Um, we like to study a drug classification or family and then get to know the action of that drug, right? That's the mechanism of action we talked about. What does this drug do to the body? Sometimes we like to get into usual dose, but again, you are a nurse, you're not a prescriber. So when we say usual dose and it includes frequency, it would be more so, um, let's say a medication that required you to know that you had to give it first thing in the morning, or if it was a medication that you should give with meals, such as insulin. That is really when you want to think about dose. You don't want to think about, okay, let's say for instance, if I'm giving lisinopril, oh, lisinopril 20 milligrams. That is important to know when you are checking the parameters on your patient, but that's not something you need to know off the top of your head. How medication is used. So how is this medication used and why is your client prescribed it? Right? For instance, an antihypertensive, most likely your patient has some type of hypertension, right? Because that's when you get into indication. What is the indication of this medication? This is when you become a prudent nurse. You start thinking about a nurse like, my patient's blood pressure for the last 3 days has been 90/50. Should he be prescribed this antihypertensive if he isn't having high blood pressure? Nursing care, right? This includes what nurses need to monitor, what nurses need to check, and what the nurse does while the patient is on this medication. A good example of this would be, let's say, anticoagulant. What do anticoagulants do? They increase your risk of bleeding. So, what are you monitoring for a patient who has an increased risk of bleeding? The number one adverse side effect would be bleeding. So, you have to look at different ways. How can you tell your patient is bleeding, right? You would monitor their hematocrit and their hemoglobin. What's another way? You would physically monitor your patient, right? That's when assessment comes into play. What are you going to assess? Well, you're going to assess your patient for bruising because a lot of time bruising on the body can show internal bleeding, right? And then you're going to start looking at your patient's orifices. When we mean orifices, I mean if I had a patient that had an increased risk of bleeding, I'm going to check to make sure they're not bleeding from their gums. I'm going to check to make sure they're not having blood in their urine or blood in their stools, right? Sometimes this can actually coincide with safety concerns, right? Which you're going to monitor. Sometimes, a lot of times, can fall into safety. Because if you're giving someone, let's say we're going to go back to antihypertensives, if you're giving someone an antihypertensive and a side effect of an antihypertensive is low blood pressure, right? Your patient started out with high blood pressure, you medicated them, now they have low blood pressure. Well, what's the safety concern? I would be concerned that my patient is going to fall because they're having orthostatic blood pressures, right? And that also hits onto side effects and adverse side effects. It is very important that you understand the difference between an adverse side effect and a side effect. A side effect is something that we know to be true. For instance, antihypertensives can cause low blood pressure, right? But when we start getting into different families, you'll see that an adverse side effect might change, right? And when we mean adverse, it's something that can harm your patient, something that can kill your patient, something that we probably didn't expect, right? I mentioned before, a lot of times with these drug cards, side effects and adverse side effects, you'll get into things where you'll see common side effects, right? Like itching. But if it's something that is common like that and you don't necessarily think it's going to bring harm to your patient or wouldn't be a reason why the patient would stop the medication, sometimes you can omit that because it becomes very generalized. It's not something that you need to know. And we'll go more on that when we do an example of a medication card on a few slides. All right, and lastly, we go into client teaching. What do you need to teach this client about the medication? I always say if you need to know the things you need to know to administer the medication, you're gonna have to end up teaching that to your client because when does the client manage their own meds at home? So they need to know what to look for. Um, for instance, if you have a patient that's on insulin and you know that they have to monitor their blood glucose or check their blood glucose before you give insulin, the patient also needs to know how to do that, right? If you know you're giving an antihypertensive and you need to know the blood pressure before you give the med, when the patient goes home, they also need to know how to check their blood pressure before they administer the med to themselves. And this is all about patient teaching. So we're still following suit with antihypertensives. The antihypertensive that we're going to go over is ACE inhibitors. So this is an example of the front of a drug card, right? A lot of times I'll put the family name of the medication and then the suffix, right? ACE inhibitors, they all end in pril. Verapamil, lisinopril, right? So then when I'm doing a flashcard independently, or even when I'm doing it with a family member or a friend, a coworker, classmate, I can only see ACE inhibitors, and it would be good if you checked yourself and see if you can answer all the questions that we just went over about parameters and side effects and adverse side effects in patient teaching. So the one thing I like about medication cards is that they're good for all types of learners, right? They're good for visual learners, they're good for auditory learners because you actually have to speak it out, right? They're good for kinetic learners because by the time you get finished writing this card out, you kind of already know most of it. And it helps with that that learning aspect. So we start with the generic name of the medication, right? Lisinopril, captopril, benzapril, they all end in pril. So it becomes kind of redundant. Mechanism of action, remember we're asking what does this drug do on a base level, right? It inhibits ACE in the kidneys, which tightens the blood vessels, causing the blood vessels to dilate, right? Kind of like a fist. You tighten your fist, and that's what's naturally happening. That's with the blood pressure. That's how your patient ended up with hypertension. Once you give them this ACE inhibitor, that fist starts to loosen up, and it's easier for the blood to flow through, right? So the indication of use would be hypertension, and a lot of people with ACE inhibitors, sometimes they use it for people who have heart failure as well. Lisinopril can affect your potassium. It can increase your potassium, right? Um, it can also affect your kidneys, and that's why under nursing care we have all these monitor potassium, monitor your kidneys. If your kidneys are affected, the first labs you want to look at is a BUN and creatinine, right? So this is how we start applying some of those labs and electrolytes that you've learned before in 142 to medications and pharmacology. Right? So this medication is not recommended in clients with renal impairment. It interacts with potassium supplements and potassium sparing. So that triggers in my mind that I need to know what a normal potassium is. So when I administer this medication to my patient, I know what their potassium level is, right? If it's abnormal or normal. Excessive NSAID use can predispose this patient to renal failure. Well, this is like a medication and medication interaction, and it's very important to know because if your patient is taking an NSAID, NSAIDs are very common over-the-counter drugs, and you give them lisinopril, it can affect their blood pressure, and it can also affect their kidneys. Side effects and adverse side effects. Again, it is very important to know the difference between the two, right? Orthostatic hypotension, a lot of times, is something we don't want to happen, but it's something we expect to happen sometimes with this medication. A dry cough, right? This medication can cause dry cough, like a hacking dry cough. And the best term for me to use is annoying. It's so annoying that it would cause your patient to not want to take the med anymore. Well, if your patient gets fed up with their dry cough and they decide, hey, I'm done with this lisinopril, I'm not taking it and I'm not telling my doctor, right? They stop taking it, and then next thing you know, they're walking around with hypertension and they end up with a stroke. So it is very important to note. And this is one of those side effects that if I need to know it, it's important that I tell my patient about it so that they know it's always different options and we just need to notify the healthcare provider. An adverse side effect, angioedema, right? It is common in blacks and Hispanics. So what's angioedema? Well, a lot of times that your tongue will swell up. Well, if your tongue swells up, that's going to obstruct your airway. So this would be an emergency. And that's why it's adverse. It's something that we don't want to happen, and we expect not to happen with most patients. And hyperkalemia, right? Hyperkalemia, increased potassium levels. So you need to know what a normal potassium level is so you can monitor your patient's potassium again. And then patient teaching. It's important with antihypertensives in general that they just don't stop taking this medication, right? If we expect for them to have orthostatic hypotension as a side effect, then we need to teach them that they need to stand up slowly, right? And change positions slowly. That's when we get into some of those Nurse 142 skills, such as dangling your patient on the side of the bed before you help them ambulate, right? What does dangling do? Well, it helps them their body level out before just jumping up and standing. And even people without antihypertensives can jump up too fast and get lightheaded, right? So these are little things we need to teach our patients. Salt substitutes are high in potassium, right? If your patients are watching their salt and they're like, hey, I'm going to use, let's say, Mrs. Dash. Well, Mrs. Dash has high potassium. That can affect their potassium. And again, if we need to know to monitor NSAID use, so does the patient. And this is just to reiterate that there are a lot of different classes and a lot of different family names under each class, right? So we touched on the beta blockers, the calcium channel blockers, the ACE inhibitors. There are other antihypertensive medications, right? Considered like thiazides and loop diuretics. These also fall under the classification of diuretics. Okay, so some medications could be used under multiple classifications just based off the mechanism of action. Because a diuretic can lower your blood pressure, which makes it an antihypertensive, but the way it lowers it is in a diuretic fashion. Okay, it decreases the volume of fluid in your vessels and helps you excrete it out most of the time through your urine. So it decreases your blood pressure in a diuretic fashion. And then we have angiotensin 2 receptor blockers, right? Um, we consider them kind of similar to ACE inhibitors, and but they have different side effects. And if one person is having I'm sorry, excuse me, if one person is having a reaction to an ACE inhibitor, sometimes they might end up with an angiotensin receptor blocker, right? And so we would do a drug card for each of these family classes, especially when we get to the hypertensive lecture. It would be important to start looking up certain medications like this and knowing the differences and the similarities in them. And like Professor Roberts, that's a lot of work, right? One drug card for one family of medication. But when you think about it, the drug card is just asking you, right? What is your responsibility as the nurse? Right? What do I need to know before I give this medication? And that just takes us back to 142, right? Before you administer a medication, you have to have those six rights. Well, how do you know that you have the right dose at the right time for the right indication if you don't know about the drug, right? So, the name of the drug, what it's used for, your responsibility as a nurse, the side effects, and the education. When you know these things about medication, you become again like the a prudent nurse, right? And if you're gonna administer a medication, that's why we always recommend you look it up before you administer it, because you don't want to give somebody something that can interact in a certain way or interact with another medication or have an adverse side effect or even have something that needs to be monitored and you're unaware that you should be monitoring that for that patient, right? Here's your role as the nurse in drug therapy. Your primary role is to administer, educate, and monitor, right? You're administering, again, those six rights. And then we also use the three tracks, right? Monitoring. What are you observing for adverse reactions and side effects? And what are you assessing, right? And then again, how do you know the medication was effective? That just took you all the way through CJMM, right? Your patient had a problem, right? Cardiovascular. You had an intervention. You gave your antihypertensive, all right? You assessed them before you gave the antihypertensive. Of course, you checked their blood pressure. That was your assessment. You did your intervention. You gave the blood pressure medication. Now you need to reassess, right? How did you know that medication was effective? Well, 30 minutes later, I went back and took their blood pressure, and it was lower than it was before. The medication is effective. All right, we can also apply that to pain medicine, for example. Your patient is in pain, right? That was the data you collected. Their pain was 5 out of 10. You gave them ibuprofen for pain. You reassessed them in 30 minutes. Now their pain is a 3 out of 10, right? It was effective. And then patient education, right? Again, if you need to know something about a medication for you to monitor that patient, a lot of times they need to know that as well. So that's when you come in as a nurse educator and you inform the patient about the medication use, the side effects, and when they need to call the physician. All right. Again, I like to reiterate, as a RN, you are not prescribing, right? This is your job. You're administering, you're monitoring, and you're educating your patient. So let's get into some application. Now we had that ACE inhibitor card. We had all of that information, and you're like, how am I supposed to take this information from these cards and apply it to my test, right? How am I supposed to apply it to these NCLEX style questions? Well, this is what it's all about. So let's answer this question. Which medication should the nurse question if prescribed together with an ACE inhibitor? Docosate sodium, furosemide Lasix, potassium chloride, or morphine. So even a lot of times when you do not know a medication, right? Let's say we haven't gone over furosemide yet, right? So you don't necessarily know what that is. But we've already discussed with the drug card that a ACE inhibitor can increase your potassium. So if an ACE inhibitor can increase your potassium, would you want to give a patient potassium? Probably not. So this is when we get in again for tips for learning pharmacology, right? Um, this is when it's important to identify what kind of learner you are. All right, so flashcards again. I'm very big on flashcards myself, but sometimes even with flashcards, you can use those mnemonics we talked about. And there are a lot of mnemonics out there for drugs. So sometimes you can either look some up or you can get creative for something that would help you remember it from your own perspective. I think I remember having a mnemonic about my dog that helped me remember a medication. You can engage with interactive resources. What does that look like? That could be ATI, right? That can be Elsevier or any other interactive resource you have, right? Sometimes even a simulation that helps us get to know medications because you can look it up and you can administer it and you're giving a medication based off how your patient is presenting, right? Apply learning to clinical. You all go to clinical and you're actually responsible for passing medications and looking those medications up. A lot of time in clinical, you start to see a lot of the same frequent medications and using visual aids. Okay, this is for my visual learners. Again, a flashcard can be a visual aid, or you can use other things like Picmonic or anything like that that can help you remember a medication based off pictures. And a lot of times, okay, pharmacology can be overwhelming. But once you get your stride and you have what works for you and how you can start applying the medications into practice and clinical, I really think it will start to help you. So here at HCC in the nursing education program, right, NEP program, we focus on concept-based learning, right? We take those concepts and we break them down to exemplars. And that's when you get into disease process. Well, what does that mean for medication application or drug therapy, right? We'll take a concept such as perfusion, an exemplar such as CVA. A CVA is a cardiovascular event, also known as a stroke, right? And we'll say, hey, what medications actually pertain to this disease process, right? A stroke is a clot most of the time in your brain. So we can give a medication within reason to burst that clot to increase the perfusion back to the brain. right? Oxygenation. We like to talk about COPD this semester. COPD is an obstructive airway disease. So what do we do with that? Well, if it's obstructing the airway, most likely it's constricting the airway. So we might give them a bronchodilator to dilate those bronchioles and increase their airway, right? And this isn't something you necessarily need to know right now today. We'll go over each of these separately when we go over these disease processes. But I just wanted to show you how we take those concepts and break them down into exemplars and what we expect for you to know based off mechanism of action again and the things we do to treat these disease processes, right? For instance, glucose regulation. A lot of people know about diabetes and insulin. Okay. So what is insulin? Insulin is naturally found in your body, but some people go without it. So we have to find ways to introduce it back into the body so the patient can have it available so they can use it, right? Hormone regulation, like hypothyroidism, right? Some people don't have enough of the thyroid hormones in their body, so we will give them synthetic thyroid. We call it Synthroid. And it will help alleviate some of those symptoms of hypothyroid. In nutrition, we'd like to talk about GERD, and I feel like we talked about that, touched on that at the beginning of the slides of like antacids, right? So there are other medications that also help with GERD, like H2 receptor blockers, and um, they block um, the receptors that increase the acid in your stomach. And then mobility, osteoarthritis. A lot of people know about osteoarthritis just from like commercials on TV and stuff like that, and how aspirin or Tylenol can help with that anti-inflammatory pathway, right? So the idea is that we will decrease the inflammation and help the patient be more mobile. So these are just some examples of some things you'll learn this semester and how we're going to apply them when it comes to drug therapy, especially intervention based, right? Anytime you give a medication, you're carrying out an intervention, all right? So once you're in that step of the nursing process, you have to know what are you monitoring, and again, how did you know that that intervention was successful, or how did you know that that intervention was not successful, right? If something did not change or if the patient did not improve. We're going to jump into some of these classifications and go over some of these medications. Um, and then you'll start to see again like how we take mechanism of action and we treat certain things about disease processes, okay? And you'll see some common classifications again, or you might actually learn some new things, like for instance like laxatives. Okay, most people know what laxatives are. They loosen the stool and increase bowel movements. um, but you probably didn't know what a mydrotic is, right? So it's going to be a lot of different classifications that you start to learn. But again, this is when we'll touch on patho, and we just don't want you to get overwhelmed. And we're going to go over some common ones that you might see this semester. But of course, in this slide, this isn't all of the classifications you'll see. We're just touching on some important ones. Okay, so this slide addresses oxygenation and COPD, which you might a medication you might definitely see with someone who has the disease of COPD is a corticosteroid. So what is a corticosteroid? Corticosteroid can be inhaled or oral. The mechanism of action of a corticosteroid is to decrease inflammation in the body. Okay, so if it is inhaled, it's going to decrease the inflammation just in the lungs, right? We consider that to be um, localized, right? We're inhaling it, we're breathing it in, it affects the lungs. But say if you take an oral corticosteroid, all right, you swallow it, it is processed through your body and your stomach and then metabolized. We consider that to be systemic. So you'll see more systemic side effects, right? It's going to affect your whole body. One thing we like to say about corticosteroids is that um, it can increase your blood sugar, right? And how your body processes insulin. So a lot of people who are diabetic, right, if they end up having a need for a steroid or taking a steroid, it will increase their blood sugars. But not only just diabetics, this can also happen to people who do not have diabetes. Another thing we like to say about corticosteroids is that corticosteroids, especially systemic corticosteroids, they increase your chance of wound infections or just infections in general because it decreases your immune system, right? We always say corticosteroids, they're good for what they're good for and then bad for everything else. Okay, so they help with inflammation, but they really have a lot of other side effects. So they're intended again for short-term use and not long-term use, right? And you'll see that a lot of times for like asthma or COPD exacerbations. And steroids can be given for a few other disease processes as well, but asthma and COPD are you'll definitely see them more common. We touched on bronchodilators. They are also considered to be adrenergic agents, and they end in EROL, so that'd be like albuterol, right? Bronchodilators, they are also inhaled, or they can be given by a nebulizer, which is also an inhalant, but it's not an inhaler. So the mechanism of action, the muscles around the airway become constricted. Okay, that's why this patient with a constricted airway might present with the cues of increased work of breathing, right? They might present as air hungry. So they'll take their bronchodilator and it will relax the muscles and dilate those vessels and help the air go through, right? So these are used to treat COPD and asthma as well. We like to say they are used for acute attacks, but they can also be used as prophylaxis. So what does that mean? If your patient wakes up and they feel okay, right, they can have a long term bronchodilator that they can use that can cover them for a few hours throughout the day. Or they can have what we like to consider to be like a rescue inhaler, right? A rescue inhaler is used during acute attacks when somebody really needs it. And again, we'll touch more on this during COPD class, but it's important for you to start getting to know like the classifications of these medications. And here we go, touching back on antihypertensive drugs. So you can kind of see they begin to be important, and you'll see them also a lot in clinical, right? ACE inhibitors, and then PRO, ARBs, right? Those are, we say they end in sartan. Alpha blockers, right? Docin, terazosin, I'm sorry. Beta blockers, right? LOL, metoprolol or betalol. Calcium channel blockers, right? That's when you get into the nicardipine and amlodipine. And diuretics, hydrochlorothiazide and furosemide. They usually end in IDE, and that's how we know that they're diuretic. So you can take some of these classes if you want to be ahead. You'll see a lot of these antihypertensives, most likely in the exam too. But it is important to know in general what antihypertensives do. They lower the blood pressure. Now, each drug class will have their own mechanism of action, and you can start diving into those as well, right? If you have a diuretic, most likely, again, they work by decreasing the amount of volume going through a vessel, right? How does that happen? It takes the water and the fluid out of the vessel and pushes it towards the kidneys, let's say in layman's terms. So let's say if you had someone with heart failure, a lot of times with heart failure, and again, heart failure isn't something you'll learn this semester, but it's just a good way to start thinking about it. Heart failure, you have increased fluid throughout the body, right? So that's when you get into third spacing. A cue for someone who might have heart failure or that their third spacing is pitting edema, right? +2, +3 edema when you take your two fingers and you press it on the feet and you're like, oh wow, I can still see the pit in this person's foot. This person might need a diuretic. What that diuretic is going to do is going to take that fluid and push it back into the vascular space. is going to go through the vascular space to the kidneys and is going to be excreted out. So this patient is going to have increased um, urination, right? A side effect of this could be your patient can become dehydrated. So it is important to start thinking about these medications and how they work and who they work for. I would like for you to focus especially on these medications as well. Another medication we touched on, we talked about perfusion. And again, perfusion, the exemplars you'll see is CVA, which is a stroke, DVT and PE, right? A deep vein thrombosis. A PE is a pulmonary embolism. You'll also see them with PVD, and so that's peripheral vascular disease and peripheral artery disease. We like to go into antiplatelet. So if you and you can see here it says antiplatelets and all the different things that um an indication of why someone might use it. But the mechanism of action again is a platelet aggregate, right? An antiplatelet aggregate. It stops the platelets from clumping together. So the most common one is aspirin. Everybody pretty much knows what aspirin is. And a lot of time when you are in practice, you'll see someone who has been prescribed an aspirin 81 milligram, and will say, "Hey, what is the use of this medication? What was the indication for your patient?" And you'll look it up in the book. A lot of times people say aspirin is for pain, but most patients take aspirin for to decrease their risk of a cardiovascular event, right? And that's like a MI, stroke, a heart attack, peripheral artery disease, coronary artery disease. We consider all of these vascular events. And taking a low dose aspirin one time a day can really help decrease that. But if your platelets aren't sticking together, what does that mean for side effects, right? Let's say your patient shaves and they cut the side of their face, but they're on a platelet aggregate. How long is it going to stop them? How long is it going to take for you to stop them from bleeding, right? So these are things we start to think about with antiplatelet medications. I guess this is good for this patient and his cardiovascular concerns, but what do I have to monitor, right? Say if your patient is walking and they fall and they hit their knee, right? How what do you have to do to stop them from bleeding? Well, you're probably going to have to apply pressure for longer, right? So you also have to teach that to the patient. If they have an increased risk of bleeding, now I have to teach them what to educate themselves. Say if they're cooking at home and they cut themselves with a knife, how do they get themselves to stop bleeding? And what do they do if they can't get themselves to stop bleeding? Well, of course they need to refer to the emergency room or urgent care, right? So this is stuff we start thinking about as far as okay, we're administering this medication, the indication of what this medication is used for, and now we're thinking about side effects and what you need to know as the nurse, and then also what you need to teach your client. Another medication cholesterol you'll see commonly is an oral anticoagulant. And one thing we do not like to hear in practice is people call this a blood thinner. No medication by mechanism of action actually thins your blood. Okay? So what does this do? And I'm going to take you back to pathophysiology, right? It stops clotting factors in that coagulation cascade, right? And each, let's say, anticoagulant, because there's many different types, like warfarin and apixaban, they act on different parts of that clotting cascade. Do I need you to know that in particular which part of the clotting cascade? No. What do I need you to know? That this can actually really help your patient prevent the formation of blood clots, right? But it can also stop them from clotting when necessary, right? When is it necessary to clot? When you're bleeding, right? If you have an accident, okay? Let's say if you have a patient on an anticoagulant and they need emergency surgery, right? You have to take that into consideration. Let's say you become an ER nurse and you have a patient that just came in from a motor vehicle accident and they're like, hey, I take warfarin, right? What indications do you have to take? Well, warfarin actually has a medication that we can give that will reverse the effects of warfarin. It's called vitamin K, right? So let's say, and warfarin also has monitoring labs. So anybody who has been prescribed warfarin, they have to go get their INR checked. And you might have heard of it before. It's called a Coumadin clinic. So they'll go get their PT and their INR checked while they're on this medication. And we've seen people who are, this is when we get into therapeutic and subtherapeutic and those levels with medications. We've seen people that are too therapeutic. So if a normal INR on warfarin therapy is 2 to 3, I've seen patients come in to the hospital and their INR was a 5. So what are you going to do to implement to make sure that patient is safe while they're in your care? And also, what are you going to do to help reverse? What's the reversal agent, right? Some medications, if you're going to administer it, you need to know what you can administer to stop the effects of that medication. Okay. Warfarin is also considered to be a vitamin K agonist. So you can give vitamin K to stop warfarin, right? It is the reversal agent. Other oral anticoagulants like apixaban, known as Eliquis, and you'll see that a lot in clinical as well. Patients don't need to be monitored as much. Okay. Another anticoagulant you might see that's not an oral anticoagulant is heparin. All right, and we'll get into heparin and heparin transfusions a little bit further in the semester. But a lot of times you give heparin in practice and it is subcute, not oral. So that's another good medication for you to look up. Okay. Well, when we speak of perfusion and we start getting to clotting, right, you'll get into what we call a clot buster or thrombolytic. This is the medication that completely bursts the clot. All right, it's short-term emergency management. This, when we say emergency management, it means your patient is in dire need of being reperfused in some kind of way. Perfusion was altered by a clot, right? Whether it was a CVA, a DVT, a PE, right? So we need to destroy this clot so that your patient can be reperfused. Because let's think about it. If a patient has a clot in their brain, they're not getting oxygen to their brain. If a patient has a clot in their lung, they're not getting oxygen to that lung. If a patient has a clot in their leg isn't getting oxygen, right? That's when cell death occurs. The best way to reperfuse is to get rid of that clot. So we like to give our clients a window, and we'll learn more about that window when we get to CVA. But if the patient is a candidate for this medication, we'll give it and it will help reperfuse them, right? That's the goal, to reestablish blood flow and limit damage to the tissue, right? We consider these thrombolytics, or we'll consider TPA, also known as alteplase. Okay, so this medication is really important when we get into perfusion.